Hello, SYNGAP Lab. My name is Michael Graglia. Today is Tuesday, February 25th, and this is episode 162 of SYNGAP 10, the SYNGAP 1 podcast. Today is a very exciting day because we have 3 SRF volunteers who are in Washington, D.C. at the Every Life Foundation's Rare Disease on the Hill event. And I'm grateful to Vicky Arteaga, Jaime, and Jessica Johnson for being there and for working with Every Life and our friends at Stoke and others who were there to advocate for rare diseases on the Hill. And there's a really cool LinkedIn post that I share at the top of the show notes. Respond to that, like it, and thank those 3 for taking time out of their lives and finding caregivers for their kids to go and to sit in front of legislators and say, hey, there's this disease called SYNGAP 1. It's a rare disease, and this is why it matters. This is important work. I say this every year. We need to have more people there next year. Mark your calendars now. We need to take the Hill by storm, and we need to make sure that our congressmen, congresswomen, and senators know about SYNGAP 1. It's only going to get more important as we get closer and closer to clinical trials, team. So that's one thing to do. Thank Vicky and Jaime and Jessica for that work and plan on going next year. Next thing to do is to get ready for Sprint for SYNGAP, April 26, 2025, guys. April 26, we're going to do Sprint for SYNGAP again, right? We had a wonderful webinar about how to host your own event. Thank you, Virginia and Anthony. Link is in the show notes, curesingap1.org/S4S25. And there's a guide, there's a PDF you can download, S4S guide, after, of course, curesingap1.org, that you can download, which will tell you everything you need to know. Why would you have an event? Hey, you got to raise money. All this work costs money, guys. We need to fund research. We need to fund the people who are driving SYNGAP awareness. But also, when you have an event, you reach out to your neighbors, your church, your school, your whatever, your therapist, and you say, hey, there's this disease that this wonderful kid you care for has. It's called SYNGAP. Help us. Come and learn about it. Come and realize that there's hope and there's community and there's an organization called Cure SYNGAP 1, also known as SYNGAP Research Fund, doing work for this disease. And you get to raise awareness and community for your loved one. And that is why we should all do an event. Yes, I want you to raise money. How much? As much as you can. But what I really want you to do is build a community and support for your family and your loved one so that every SYNGAPian is taken care of. Because these kids are a lot of work, guys. These kids are a lot of work. And then I want money. Why do I want money? Because we fund research and there's so much work to do. And the money we spend, this is important, the money we spend makes a huge difference and unlocks other money. What does that mean, Mike? You sound so poetic. Unlocks other money. Example, in Finland right now, I want to offer our congratulations, which I have done on LinkedIn, and you should like and comment on reply to this one. Alia Esam is a researcher at the University of Turku, which I had never heard of either until we funded this work. But it is apparently a great university in Finland where we have 2 incredible researchers, 2 incredible research teams, I should say. We have Dr. Courtney's lab, and then we have Pekka Pastilla and his team. And Dr. Courtney is doing in vitro work, meaning in glass. He's doing lab work. And Dr. Pastilla and his colleagues are doing in silico work, meaning in computers. And they're both working on missense mutations and understanding how different missense mutations affect SYNGAP 1. And Alia was a postdoc in their lab working on SYNGAP, and she announced on LinkedIn that she just got a very large grant, and she will now keep working on SYNGAP for 3 years. So we gave a small grant to Finland to work to support that. Actually, it wasn't small. It was a couple of decent-sized grants. And now, as a result of that, Alia is building, or not just found some money to fund her work on SYNGAP, but she's going to spend a few years. She's going to become a global SYNGAP expert in the area of missense. This is huge progress. And when we fund young researchers, we affect whole careers and timelines, right? This work is generational, and you got to get them when they're young and smart and working super hard. You remember how hard you worked when you were in your 20s? Like, I'm pushing 50 right now. I'm like, oh God, I got to do a podcast. Like, I used to do so much work 30 years ago. That's what we need. We need those 20-somethings who are motivated and driven and changing the world, thinking about SYNGAP 1. And for that, we need to fund their postdoctoral work. And for that, we need money. And for that, you should host a Sprint for SYNGAP event. Look at how I tied all that up. And then once you've done that, once you've gone to LinkedIn and liked the advocacy post and organized your Sprint for SYNGAP event, I need you to email the DREEM study, right? So if you go to our website, study of the week is the DREEM study. This is working with Beacon Biosignals to put the headset on. It's a super simple headset. Next week, I'm going to remember to bring it and show you in the video how easy this thing is, and put it on your kid every night for 2 weeks. And then with that data, we show that, guess what? You can collect EEG at home. And guess what that means? That means we don't have to go into the clinic and do as many EEGs. There's an easier way to do this work, guys, for clinical trials. It's a super important study. It's a chance for you to touch the future. The Beacon Biosignals DREEM is an FDA-approved device. It is an incredible device. Please check it out. There's a lot of studies SRF is supporting. We have a tracker. It's on the links in the show notes. Check it out. If you remember last episode 162, I talked about the impact report and how excited I was about that. I'm still excited about it. And I want to thank Ed, who tirelessly writes our newsletters for newsletter 43, curesyncap1.org/NL43. And he talked a lot in the newsletter about the impact report. So if you have the newsletter in your inbox, which you should, because you should be subscribed to our newsletter, forward that to your friends, your loved ones, your doctor, your therapist, everybody. Say, hey, check out, read this report, learn about it. It's so exciting. Couple of other cool things on our website. I just want to remind or let people know we've added a calendar, curesyncap1.org/calendar. We're still populating it, but this is super exciting. Now you can go and see what's going on and when. For instance, if you go there now, you would see that we have a webinar. I think it's on Friday with, is it on Friday or is it tomorrow? Let me look it up real quick on our handy dandy website with Elamy, who is the BCBA that is a real SYNGAP expert. And she is doing something about what to do when your Syngapian drops. And we all know when those Syngapians start dropping, use a whole lot of nothing you can do because they are big, strong kids and they go into puddles on the floor. So how do you deal with that? Elamy, February 27th. That will be the day after tomorrow at our usual webinar time. So the calendar is really cool. Check out the calendar. We've also updated our brochure. People have events. They go to church events. They talk about SYNGAP in different places. We have a beautiful trifold brochure, curesyncap1.org/brochure. Download it, print it. Call us, ask us to print it. I think we charge something for that, but we'll do it for you. Whatever you need, we want people to learn about SYNGAP and learn about SRF, so we have a brochure. And then I want to thank Roy Morris, who is this incredible technologist in Canada, who's a dad and takes great care of his son, James. But he also helps us with videos. So our Family Day talks are getting up on YouTube. Thank you, Roy, for your work. So that's a lot of online Did You Know. Company of the Week, I want to talk about Stoke Therapeutics and Biogen. So Stoke, $500 million company, announced that Biogen, $20.5 billion company, are partnering on global commercialization for Stoke's Dravet drug. Why does this matter? It matters for a lot of reasons. Stoke, amazing company. I love them. They know I love them. $500 million company. Some would dismissively call them a startup. I would say they are shaping the future of medicine. But, $500 million company. Biogen, $20 billion company, significant player in this space, has partnered with them to take their drug, this disease-modifying therapy for Dravet, out into different medical communities. And there's a lot of muscle memory there, right? Stoke really good at the preclinical work, the hardcore science. These are incredible scientists and doctors, Dr. Edward Kay and others, changing the future, Barry Tycho. But Biogen just has this incredible reach, and they're going to start talking about things like disease-modifying therapies, drugs like the ASOs and gene therapies we want to go in and upregulate the missing protein, and non-seizure endpoints, right? Remember a couple years ago, people were like, seizure, SYNGAP doesn't have seizures, what are we going to measure? Oh no! Now, Stoke, working on Dravet, seizure, is talking about non-seizure endpoints. This is incredible, and they're getting Biogen to do the same thing. This is incredible work, and what they're basically doing is clearing the path for us when either Stoke or another company decides to go to clinical trials for SYNGAP1. So that's huge progress and tremendously validating for those of us who've been saying, look, disease-modifying therapy is the only way to go because our kids right now are on fistfuls of drugs and it's not acceptable. And we can measure not just seizures, which in SYNGAP in the earlier years are harder to measure because we go from absent seizures, which are playing hell with the brain, but hard to see visually. I shouldn't say that anyway. It doesn't matter. To drop seizures, which are terrible, right? So if we can also measure non-seizure endpoints, as Stoke is doing with Dravet, then we've got stuff to measure and we can do clinical trials. Very exciting. Congratulations to our friends at Stoke. I want to talk a little bit about travel. I think in the last episode I talked about clinical trials. Here's the thing about clinical trials. You're going to have to travel with your Syngapian. I think many of us are willing to do that. Many of us have figured out how to travel. There are a handful of parents who've called me and said, Mike, I don't travel. I can't go to this natural history study because I haven't, my kid is now 15. They've never been on a plane. Get your kid on a plane, people. Figure it out. Figure it out. If you gotta give them a little bit of extra whatever to help get them on the plane, do it. But get your child out into the world. The world deserves to meet your kid. Your kid deserves to see the world. And you're going to have to travel for clinical trials and for clinical care in their life. So figure it out now. And what's exciting about this, number one, I already said this. Number two, if you listen to episode 31 of SYNGAP Stories, the latest episode of SYNGAP Stories, which was our interview series led by Ashley Fry, now taken over by Rainey. Thank you, Rainey. She interviews the Navarros, Anthony Navarro, our fundraising guy, Chelsea Navarro. And Chelsea was so interested in this idea of special needs travel, she became a special needs travel agent. I didn't even know that was a thing. But now the next time I travel, I'm going to call Chelsea because she is apparently a certified special needs travel agent. So she can help us navigate how to think about a trip and how to book travel and all that goodness. So that was a really cool interview and I was glad to listen to it. But also, all these podcasts, you should be subscribed to this podcast and you should like it wherever you listen to it. But we also put them up on YouTube. And I love the comments on YouTube. And I think a couple episodes ago when I was talking about travel, somebody was like, hey, Heather Bench did a cool session on travel. And they shared that video in the comments. So please do leave comments on YouTube. And on the topic of travel, which is clearly listed inside my show notes for this, I'm going to hashtag it special needs travel because I love a good hashtag. Special, I can't spell special, which is weird. Needs travel. You can also watch Heather's thing. Okay, moving on. Research update. Oh, this is important. In fact, if you notice the cover for this podcast episode, it was a bunch of weird bar graphs. And you're like, why are we looking at bar graphs? It's very exciting. So there's 318 papers on SYNGAP 1. 54 of those papers were in 2024. So far in 2025, we have 10 papers. The Jeff Coller paper is finally showing up in that list for those who are tracking the paper situation. But it's not the Coller paper I want to talk about. It's the third, thank you so much, Dr. Fraser, the third paper from Dr. Tom Fraser on the neurobehavioral evaluation tool, which, as a reminder, is a tool where the camera on your phone or iPad or computer watches the eyes and video is rendered. The kid watches the video and we collect data. And this is so incredible. This is so incredible. It's just incredible. And what you see in this chart that is the cover of this podcast episode, you can see that SYNGAP 1 is in yellow, right? So global social attention, social preference, facial affect recognition, speed to faces. These are all areas where SYNGAPians really have a distinct profile, and that is measured passively by this camera. The kid doesn't have to say a thing. They can be totally nonverbal. But just seeing how the child's eye, the patient's eyes, respond to the images on the screen, this tool being developed by Dr. Fraser and now on its third publication, measures these things. And we're collecting data on SYNGAPians because you, thank you very much, have taken part in these studies for the neurobehavioral evaluation tool. Guys, if you do anything, the DREEM study and the neurobehavioral evaluation tool, these are important studies where we're collecting valuable data and laying the groundwork for effective clinical trials. It is so important. It is so important. If you don't get it, call me, call Virginia, call Lauren. We'll help you get it. And then sign up for these trials. If you're stuck at home and you're depressed and you're overwhelmed and you're scared about the future, this is how you deal with a scary future. You help make it better. So get on that. Thank you, Dr. Fraser. Go read that paper, guys. It's really good. Links in the show notes. Fraser paper on net. Super exciting. Volunteer Spotlight. I want to thank Toby Brimsek and John Brimsek. Toby and John are grandparents to Emily Brimsek and Eric's daughter. And they called me and they were like, how are you thanking your donors? And we were just like running around doing all that. We're like, we don't thank our donors. We're so busy. And Toby said, you need to thank your donors. Let me do it. So Toby for a while now has just been calling donors every month and saying, thank you for your donation. I'm a grandparent. This is so important. Thank you so much. And it's, I get it. I hear about it from donors. Donors call me. They're like, hey, this was really classy. Nice touch. Thank you very much. And it's great. Toby called me one day. She's like, hey, I saw you made our donation. I was like, Toby, why? Same team, whatever. It's great. It's lovely, lovely, lovely work. And I want to thank them. They are, so number one, thank you. Number two, they're taking a break from this work because they have some family matters to address. And so that is now a volunteer opening, by the way. So, you know how to become a volunteer. You go to SYNGAP curesingap1.org/volunteer with SRF, or you just email Zoe, Z-O-E, at curesingap1.org and say, hey, I want to volunteer. And guess what? We'll hook you up. And if you want to call people every month and thank them and tell them why this was important and why you're grateful to them supporting SRF, people really appreciate these phone calls. And I'm going to miss Toby and John doing this. I'm grateful that they did, and we need another volunteer. So thank you, Toby and John. And if you're out there being like, I don't know any science, what can I do? You can call people. There's every single person who loves the Syngapian can find a way to take action and make the future better for the people they love. Conference. We have a conference December 4th and 5th. I know that feels a long way away, but it's not. Guys. This is the annual heartbeat of our community. This is when we all come together. This is when we all connect, support each other, learn. I am confident that this year's conference is going to be a very big deal for a number of reasons that I'm not going to get into. But if you have never been to Atlanta, Atlanta's great. Suzanne Jones is there. She's going to be an incredible hostess. The conference team really killed it last year in LA. And this year we're just gonna up our game again in Atlanta. So pre-register for the conference now. Book your tickets now. Plan on coming to Atlanta. Maybe call Chelsea about going, and let's do it. I want to bring up the topic of brain donation, which I'm going to try to do every month or so. God forbid your child gets sick and dies, or is in a car accident or whatever. But it's really hard to call a family who's grieving a day after their kids died and been like, hey, can we have the brain? The brain of a Syngapian would be great for research. That just doesn't happen. So I just want to say it now, while all our kids are vertical and healthy, it is if and when your child passes, if they are pre-registered for brain donation and you've already had the conversation with family and you've already said, look, God forbid there's an accident or something unfortunate happens, but this child's brain could really be used to accelerate research. It's something you can do, and we have vetted everybody. I've had families call me and ask me about this. Autism BrainNet is an incredibly well-funded and effective group that does help collect brains with nothing but care and concern and class. But those brains can really change the game for research and help others with SYNGAP1. So I don't want any of our kids to pass. And the truth is, none of us are getting out of here alive. So it would be great if, as and when our patients pass, we collect those brains and we make them available to researchers. On that happy note, let's wrap it up. We have 3,937 followers on LinkedIn. LinkedIn is where it's at, guys. Make sure you're following curesingap1 on LinkedIn. Make sure you like our stuff and share it out. We're also on YouTube, Twitter, Insta. If you're newly diagnosed, please, syngap.fund/resources. That is where you're going to find all the resources you need. Reach out to us. Let us help you. I need to talk about newly diagnosed family. I'll do that in the next episode. This is a podcast. Please give us a 5-star review. Thank you for listening. This has been episode 162 of SYNGAP 10. I'll see you soon.